About 1 in 8 women will at some point in their life have some sort of breast cancer. According to my research from the website of WebMD, the article The Breast Cancer Overview states that if 8 women live to be at least 85 years old, they will at least have one woman will at least have some sort of breast cancer in their life. I would like to inform you about the description, causes, symptoms, diagnosis, and treatment of breast cancer. I will begin by describing what exactly breast cancer is. According to the Guide to Women's Cancer by the Mayo Clinic, breast cancer is a common term for a cancerous or malignant tumor that starts in the cells that line the ducts and lobes of the breast. According to Breast Cancer, a complete guide, cancer is the abnormal growth of cells, often resulting in the formation of a tumor. Benign, also known as non-cancerous tumors, can result from a limited loss of growth control of the cells. According to the Guide of Women's Cancer, there are many types of breast cancer. Some of the main types being invasive ductal carcinoma, invasive lobular carcinoma, lobular carcinoma in the situ, and lobular and ductal carcinoma in the situ. One main uncommon breast cancer is also from Paget's disease. Invasive ductal carcinoma is the most common type of breast cancer. It begins in the duct and breaks through the wall and then invades the connective or fatty tissue of the breast. Once it reaches the breast, it is not stricken to only the breast. It may spread to other parts of the body. Invasive lobular carcinoma is another type of breast cancer that can be spread to other parts of the body. It starts out in the lobules and in turn breaks through the fatty tissue of the breast. Ductal carcinoma in situ, which means confined to the breast, is the most common type of non-invasive breast cancer. Lobular carcinoma in situ begins in the lobules instead of the ducts of the breast. Women diagnosed with this have a higher chance of developing more cancer in either breast. Paget's disease is a type of breast cancer, but it involves the nipple and is very rare. Now you hear me speaking of invasive and non-invasive. Invasive means that more than likely the cancer will spread from the breast to the lymph nodes and other parts of the body. Uninvasive means it'll stay within the tissues of the one breast which is affected. Since we now know what breast cancer is, we will now find out the causes. What are the causes of breast cancer? According to the website WebMD, the Breast Cancer Guide says, although the precise causes of breast cancer are unclear, we are sure of the main risk factors. Those including the greater exposure to the hormone estrogen, the greater chance of getting breast cancer. Other factors may include menstruation before the age of 12, if a woman has their first child after the age of 30, if a woman starts menstruating after 55, if a woman whose diet is high in fat is also more likely to get breast cancer. Heavy doses of radiation therapy, advancing age, family history, and excessive alcohol use are main factors in developing breast cancer as well. How do you know if you have breast cancer? I'll inform you of the symptoms of this disease. According to the Breast Cancer Guide by WebMD, the main symptoms of breast cancer will include a lump in the breast or underarm that persists after menstruation, swelling in the armpit, pain or tenderness in the breast, change in size, contour, texture, or temperature of the breast, a marble-like area under the skin, an area that is distinctly different from any other area of the breast. Discharge may be clear, bloody, any other color would be alarming. Itching, burning sensation, or ulceration is another symptom of breast cancer. After knowing the symptoms, you are now going to find out how a person is diagnosed. According to Breast Cancer, the Complete Guide by Herschel and Pressman, how is breast cancer diagnosed? A self-breast examination should be performed once every month. If a woman notices some sort of difference, it should be examined by their doctor. Differences, I mean by lumps, or difference in texture, or if the color is off. Once you see a doctor, they should prescribe you. They will let you know what you're feeling is normal or abnormal. They may prescribe you to have a mammogram, MRI, X-ray, whatever they think is best. treatments are an X-ray of the breast that pictures fat, fibrous tissue, the lids, the ducts, the blood vessels, and other tissues. MRI, which is shown in this picture, can determine the extent of the cancer in order to see whether the tumor can be removed by a lumpectomy or mastectomy, which normally means if the MRI shows that the tumor has only stayed in the breast, then they may consider doing a lumpectomy where it has spread throughout the breast to another breast or to the lymph nodes. They may consider telling the patient to get a mastectomy. Now I will explain the most common treatments that a person with breast cancer may choose. What are some ways to treat breast cancer? According to the Mayo Clinic's Guide to Women's Cancer, surgery is usually the first step in treating breast cancer. The two main surgeries for treating breast cancer are a lumpectomy and a mastectomy, as I just talked about. A lumpectomy is where the only part of your breast that contains the tumor is removed. However, with a lumpectomy, you're leaving yourself at the risk of catching cancer in other parts of your body because all the tissue has not been removed. In a mastectomy, the whole breast is removed. This may be performed when a lumpectomy is not possible or the tumor may be too big. Sometimes women prefer to get a mastectomy or even a double mastectomy just to be safe. Chemotherapy is another form of treatment. It is a group of medications that is toxic to cancer cells. However, it is also toxic to healthy cells, which can lead to some adverse side effects, which normally, I guess in most cases, would be like vomiting or nausea. Radiation therapy uses high-energy X-rays to kill cancer cells or cause them to lose their ability to grow and divide. Hormone therapy is a way of blocking the effects of estrogen, which fuels many cases of breast cancer. I hope I've helped you to better understand the basics of breast cancer from what it is to its cause or risk factors, symptoms of the disease, diagnosis, and the treatment. Just to refresh your memory, this is an example of a biopsy. They stick the needle in and they stick the needle in a cancerous tumor and they pull out the fluid from it to see if it's cancerous or benign. This is an example of a breast with cancer. It shows the tumor right here and the duct of the breast, the lobules right here, and it can spread throughout the body to the lymph nodes up here. This is an example of a breast cancer cell. The difference between invasive and non-invasive cancer is invasive can spread throughout the body, and non-invasive usually stays within the breast. My mom is one of many who have been affected by the disease. There's a reason why this whole month is dedicated to breast cancer. Breast cancer is the most common life-threatening cancer among women in the United States. It is the second most cause of cancer of death in women, and the main cause of cancer death in women ages 40 to 55. According to the Guide to Women's Cancer, October is dedicated to breast cancer awareness to not only spread the word, but to prevent the disease and to also raise money through the benefits and research to find a cure.